My name is Elizabeth Fondrick, and I'm a student nurse, and this is the head-to-toe assessment for Nursing 325. This is my volunteer patient. And what is your name, sir?
Terry.
Terry, nice to meet you, Terry. What I'm going to be doing is we'll start out with an interview portion where I'll be gathering subjective information, and then we'll take a break, and then we'll move on to the physical assessment portion of this assessment. So the first thing that I'm going to be doing is washing my hands. During this assessment, I won't require that you disrobe. During the portion of the assessment where I would be visualizing and assessing the skin, I'll just be talking through that. I won't need you to take off your clothes for that. There are some pieces of equipment which I don't own, and so I'll be just verbalizing that I would be using those tools during the assessment. Without any further ado, let's get started.
Okay.
All right. So your name is Terry,
Yes.
and your date of birth is,
9/5/73.
and that makes you then 42 years old, correct?
Yeah.
Okay. And I would also ask about your address and phone number, but since this is not a real life situation, we will skip through that. Do you have a primary care provider?
No.
What is your race?
White.
Okay, are you Hispanic?
No.
And what level of education do you have?
High school.
High school? Okay. What's your occupation?
Truck driver.
Okay. And what brings you here today? What brings you in?
We have to do this video.
Okay. All right. So I'm going to ask you to remember 3 words, and then I'll ask you again what these 3 words are later on, and then I'll ask you again what these 3 words are. So the three words are pencil, red, and square. Can you repeat those words for me?
Red square pencil.
Okay. All right. Did you have any problems with your birth or during when your mother was pregnant with you? Are you aware of any problems?
No, not to the more.
Okay. Did you have any major childhood illnesses?
No.
Have you had your flu shot this year?
No.
Are you interested in getting your flu
No,
shot
I
this
am
year?
not.
Okay. Are you current on your tetanus shot?
Yes.
Okay. What about your other vaccinations, like your MMR?
I
or
doubt it. I don't know.
No. Okay. Do you remember where you would have gotten those vaccines?
No.
All right. Have you seen a dentist or an ophthalmologist this year?
Yes and yes.
Okay. Are you currently ill, or do you have any chronic illnesses?
No.
Have you ever had surgery before?
No.
Have you had any significant injuries?
I broke my leg last year.
Which leg was it?
Right.
Okay. What part of the leg was it? Was it your upper
It's
leg or
right here.
down there on the
Yes.
outside or the inside?
Outside.
Outside. Okay. Did you have surgery to correct it? Did they
No.
put any plates or anything in there?
No.
Okay. And how's it feeling now? Are you
Okay.
any soreness or change with your range of
No.
motion or anything like
No.
that? Okay. All right. Are you currently having any pain?
No.
Nowhere in your body?
No.
Okay. Are you allergic to any medications or foods?
No.
Do you take any medications on a regular basis?
No.
Do you take any over-the-counter medications or herbal preparations?
No.
Do you have a family history of cancer, diabetes, heart disease, other chronic diseases or conditions that you're aware of?
Not that I'm aware of, no.
Alright. Any problems with your skin, hair, or nails? Have you noticed any changes recently?
No.
Any open wounds, skin conditions, infections,
No.
itching, bruising, rashes, anything like that? No changes in any moles or birthmarks?
No.
Have you noticed any change in your hearing or reduced hearing, ringing or buzzing in your ears?
No.
Have you had any problem with your mouth, dental problems, pain in your teeth, or okay, no problems swallowing or dental grinding, problems breathing through your nose, snoring?
No.
Any problems with your changing taste or smell?
No.
Any difficulty breathing, shortness of breath, chest pain, cough?
No.
Any lumps or swelling under your arms or in your chest?
No.
Do you use tobacco?
No.
Have you ever used tobacco in your lifetime?
Yes.
How long has it been since you quit?
A year.
Okay. Have you noticed any change in your chest size? Have you had any breast growth or anything like that?
No.
No lymph node tenderness in your armpits? Okay. Have you had any fast or irregular heartbeat? Do you get tired easily? Or had any swelling in your ankles or feet?
No.
Have you had any swelling in your hands or cramping, pain, abdominal, or abnormal leg veins? Anything
No.
like that?
No.
No spider veins or anything like that
No.
in your legs? Any tenderness or pain in your abdomen, nausea, vomiting, diarrhea, blood in your stools, changes to the color, consistency, frequency, appetite changes, anything like that?
No.
Alright. Any pain with taking in a breath, heartburn,
No.
any known liver disease? At this point in time, I would be asking my patient about questions regarding the genitalia as well as the anus, rectum, and prostate. I will spare my patient those questions at this point in time. I would be asking questions specifically regarding penile and testicular pain and tenderness, genital sores, lumps, swelling, heaviness or dragging, feeling in the scrotum, changing in sexual pattern or desire, any erectile dysfunction, painful intercourse or painful ejaculation, or any kind of abnormal penile discharge. I would also be asking questions regarding difficulty with urination or frequency of urination or frequent urination during the night, change in urine color, also questions regarding hemorrhoids or itching of the anal region, blood in the stool, difficulty with or pain with passing stool, or loss of bowel control. So back to you, Terry. Are you having any muscle pain, joint pain,
No.
difficulty bending any of your joints, or,
No.
or loss of range of motion in any of your joints?
No.
Have you had any neck pain or back pain?
No.
Any artificial joints, limbs, or hardware?
No.
Do you wear glasses or contact lenses?
Yep.
Are you currently wearing glasses or
Yes.
contact? Oh, okay, you've got your contact lenses in?
Yes.
Okay. Have you noticed any eye pain or discharge, any drainage or anything like that from your eyes?
No.
Any complaints about your contacts? Are they feeling okay for you?
No.
Alright. Have you had any headache or seizure, numbness, tingling?
No.
A history of head injury?
No.
Are you experiencing any facial numbness?
No.
Have you noticed any memory loss?
No.
Do you require any assistance to take care of yourself during your day-to-day activities?
No.
Do you eat an adequate diet every day?
Yes.
Are you eating 3 times a day or more?
Yeah.
Okay. And what about fluids? Are you drinking plenty of water?
Yep.
Do you exercise on a regular basis?
No.
And how much would you say that you think you get in sleep every night? How many hours do you think you sleep a day?
About 8.
Do you take any medications or drugs that are not prescribed to you, or that you're for recreation?
No.
Do you use alcohol?
Yeah.
How often are you drinking alcohol?
Once a week or so.
How much do you drink?
A few drinks.
Come on, you get it done. Out. No.
Well,
get out.
upstairs with Ralph.
Stop it.
Take Ralphie. There you go.
How much alcohol do you drink in a week?
About once a week.
And how much do you drink during
A
that?
couple drinks.
Okay. Like 2?
Yeah.
How has your mood been?
Good.
Have you experienced any depression?
No.
Do you think that you cope pretty well with your daily stressors and your life in general?
Yeah.
Are you satisfied with your work?
Yes.
Do you have social activities?
No.
Do you do things for fun?
No.
Do you have friends?
Absolutely not.
Do you have any religious affiliations?
No.
Would you consider yourself a spiritual person?
No.
So I'm going to ask you to read on my chart back here,
Yeah.
the smallest line that you can see clearly with one eye covered.
FELOPZD.
Fantastic. And if you cover the other eye and then do the same thing.
FELOBZD.
Okay, great. All right, and I'm gonna ask you to cover one ear, and I'm gonna whisper a word, and if you'll repeat.
Firecracker. Baseball.
All right.
Returning for the physical portion of this exam, I'm gonna rewash my hands. I'm observing this patient to be a well-nourished male who appears to be the stated age of 42 years old. His skin color is even and normal for his for this patient at a medium beige. He does have some well-healed facial acne scarring. I'm gonna ask him to let me know when you see my hands. We're gonna check your peripheral vision, and then I'm gonna ask you to we're gonna do a balance test, okay? So I'm gonna put my hands back here, just let me know when you see my fingers moving, okay?
Right there.
Alright, and I'll do it one more time.
Your fingers aren't moving.
Okay, but did you see my
Yeah.
hand? Okay.
Yeah.
Alright. Okay, so I'm gonna have you put your feet together. Alright, and your hands flat at your sides. Okay, and then I'm gonna just put my hands here in case you get dizzy, but go ahead and close your eyes. Alright, thank you very much. Okay, and then I'll have you put your feet together again. Alright, and close your eyes. And then touch your finger to your nose, your forefinger to your nose. And then the other hand too. Excellent. Okay, thank you very much. Alright, go ahead and have a seat. Edit point. You stand up. I need to take some measurements. Okay. I'm going to take some measurements as well. And you are, how tall?
6'2",
And how much do you weigh?
225.
Okay. Alright, so I'm gonna take some measurements. I'll measure your arm. Go ahead and just relax this thing here. So I'm gonna check mid-arm circumference. So I'm gonna find the mid-arm here by measuring from the shoulder to the elbow. And then measuring the circumference at that point. Which is 37 centimeters. And then I'm also going to measure waist circumference. So can you just kind of lean sideways here? Okay. Thank you. Okay, you can stand up straight again. I just needed to find your natural waist. So 106 centimeters. And then hip circumference. $105 centimeters. And then I will be calculating from those measurements the waist to hip ratio, the mid-arm muscle mass circumference, ideal body weight, and body mass index as well. All right, please have a seat. All right, so the first thing that I'll be doing with the physical exam is a mental status exam. A lot of this information can be gained through the subjective portion of the examination, such as level of consciousness. This person has already, the patient has already told me his name, why he's here. Do you know what day it is, sir?
Saturday.
Okay. All right, so he is alert and oriented ×3, not ×4. So he's also got I've been observing his posture and body movements. He is relaxed. His shoulders are erect, and his gait is rhythmic and coordinated. His he does have appropriate eye contact, and he smiles and frowns appropriately. His facial expressions are appropriate to the situation. His speech is appropriate, clear, and at moderate pace. I did ask him earlier about his mood, and he reported that he has not been experiencing any depression, denies any mood issues. His thought processes are clear, and I will be, assessing that throughout the examination as well. He's been answering questions appropriately to the situation. Also, much of his cognitive abilities are able to be assessed through the subjective portion of the exam. He's able to listen and follow directions, recall past events and recent events. Can you remember those 3 words that I asked you before?
Red square pencil.
Okay. And then I would be also giving the patient a specimen cup for a urine sample, but we're going to not do that for this video. That would be to check for a Regent dip or for a clean catch specimen if that was ordered. So at this point I would be checking his skin, but I would also be checking his skin also throughout the examination in the different portions of the exam. I would be checking for color variations, texture, temperature, also turgor, edema, and lesions. I would be noting for any odor emanating from the skin, also skin integrity. I would be looking for any rashes, odd moles. I'll be palpating the skin for texture and thickness, also checking for moisture at any skin folds or hidden areas of the skin. My patient will be leaving his clothes on rather than removing his clothes and putting on a gown. If my patient was wearing a gown, I would be protecting his dignity by only uncovering the portion of his skin that I needed to assess at that time. Also, when you are checking your own skin, make sure and look at the parts of your skin that you don't frequently see, like the bottoms of your feet, and use a mirror to check your back, or have your significant other take a look at your moles to see if they're changing. Alright, so I'm going to start the head to toe exam by starting at the top, by taking a look at your head. You said you don't have any sore spots or tenderness or any concerns about your hair or anything like that, correct?
No.
Okay. All right. So I'm looking to make sure that your head is clean and dry, that you don't have any swellings, tenderness, or depressions in the scalp, or lesions. I would be moving the hair in at least 3 different spots. This patient doesn't have much hair to move, so it's pretty easy to see that his scalp is clean, dry, and intact. I do note the consistency and distribution and the color of the hair. His hair is graying, and he has got some thinning spots at the crown and at the hairline here in a typical male pattern baldness fashion, nothing unusual. It's consistent with his stated age and with ethnic background. I'd be observing his face for symmetry, also for his features, for smiling and frowning and expressions, and the condition of his skin. His skin is clear and intact. His face is symmetrical. If you wouldn't mind making some expressions for me, if you would smile and frown. And would you mind blowing out your cheeks for me? Thank you. And that's to check the different cranial, the cranial nerve number 7. Would you mind squeezing your eyes tight shut for me? Thank you very much. Also for cranial nerve number 7. And these are different expressions that I could be checking also throughout the examination. be checking the sensations in the forehead and the chin, and I can combine this assessment with percussing the sinuses. So I'm going to touch you now by pressing on your cheeks here and on your forehead and tapping a bit. Any tenderness here?
No,
Okay. Alright. And I'd be palpating the temporal arteries for elasticity and tenderness. Any soreness here?
no,
Okay. Alright. Would you mind opening and closing your mouth for me? Checking the TMJ joint for any crepitus or clicking. Okay. Alright. To make sure that that's non-tender and that there's full movement in the mandible joint. Alright, and so I'm going to be looking also at your eyes, doing an external inspection of the eyes, the eyelashes, the eyelids, and the eyebrows, looking for any discharge, the distribution of the hair, also checking to see the set of the eyes, looking for redness or drainage. I'd also use my pen light to check for pupillary reaction. I don't have a pen light, and I don't have a flashlight either. So I'm going to pretend that I have a pen light. So I would shine that into this eye to watch for the pupil reaction. I would also be watching for the other pupil to respond as well, a symmetrical reaction. And I would do the same thing on this side, and then I would do it again. Also, I would be testing accommodation of the pupils by asking you to follow my fingers here with your eyes. Would you follow my fingers with your eyes? Okay. In. And watching the pupil reaction as the focus, the point of focus is closer in, the pupil size should constrict, and as the point of focus extends out, the pupil size should expand. I would also be watching for nystagmus as the extraocular, with the extraocular movements. And I haven't seen any of that here, so it looks very normal. And this is checking also the cranial nerves 3, 4, and 6. I would also use my light to check the corneal reflex by standing 10 to 15 inches away and shining my light directly at my patient's eye and looking for the round red reflex of the cornea. And again. Alright, be checking that through my ophthalmoscope, which I also don't have. So I will be pretending to use the ophthalmoscope as well. Again, with the ophthalmoscope, I will be checking the interior of the eye to look at the optic disc, the retinal vessels, also the retinal background, the fovea and the macula, and the interior anterior chamber. Using the eye opposite so we don't bump noses on inspection. And using my finger braced on the patient's forehead to steady. Alright, next I'll be taking a look at my patient's ears, inspecting the outside of the patient's ears, the auricle and the tragus and the lobule, and palpating there, so checking behind, looking for skin changes, tenderness, signs of infection. and making sure that the auricle and mastoid process as well are non-tender. I'll use an otoscope to inspect the auditory canal to check that that is pink and smooth, not occluded with cerumen. Pulling upward and outward on the external ear to extend the ear canal and straighten it. And looking at the tympanic membrane to make sure that there's no bulging or retractions. And in this case, they should be pearly gray, shiny, translucent, without tenderness or pain. Be looking at my patient's external nose as well, looking for symmetry, skin color. The skin color should be consistent with the rest of his face. The texture should be smooth. Be palpating his nose to make sure that it's non-tender. I would be checking for his ability to smell, and that the patency of airflow through his nares is intact, with different scents, coffee. Alright, I'll be checking my patient's external mouth, his lips, checking to see if the skin of his lips is intact and the consistency of the color. Also, I will be checking his teeth. I will be noting the color, condition, and checking for obvious dental work. If you wouldn't mind opening your mouth, I'd be using my light to check here. Okay, I will be inspecting the hard and soft palates. They should be, the hard palate should be pale, whitish in color. The wrinkle-like folds, the rugae, should be obvious, and the soft palate should be pinkish, spongy, and smooth in texture. I would be observing the uvula, which should be midline in the throat. It shouldn't be red, and there should be no drainage or exudate. I would also be assessing for the gag reflex, which is the cranial nerve 10. To do that, I would be depressing the tongue midline. To avoid eliciting a gag reflex, I would depress the tongue slightly off midline. I'm not going to elicit a gag reflex for the comfort of my patient today. I know that he has a gag reflex, so we'll spare him that today. But I will inspect his hard and soft palates, if you wouldn't mind opening your mouth, and the uvula, and I would check his tonsils as well, since he's got his mouth open for me. Alright. You say ah. Alright, and checking tongue strength as well. Next, I'll be checking his neck. The inspection of his neck includes the general appearance, looking for any obvious bulging or gross deformity of his neck. I'll be checking his range of motion, also the range of motion against resistance. So if you wouldn't mind touching your chin to your chest, and then look up, and then look to your right and to your left, and then can you lay your ear to your shoulder, other side? Okay, and then can you do the same against resistance. Okay, and then chin to your chest, and then back. Fantastic. Alright, any of that cause you any pain or
No.
discomfort? Okay. Alright, I would be palpating for, swelling or tenderness, of the lymph nodes, any of that sore?
No.
Okay. I'd palpate his trachea, it should be midline. And then also palpating for the thyroid gland. Can you lower your chin a bit? Checking for the cricoid cartilage and pushing the trachea to the right. Can you swallow? Alright. And then pushing the trachea to the left. Swallow again. Alright, thank you. And feeling for the lobes of the thyroid, they should feel smooth and rubbery without any nodules. I would then auscultate the carotid arteries, listening for thrills or bruits, because I don't have a stethoscope at home. I will be mimicking using a stethoscope. So I would use the bell portion of the stethoscope to listen to the carotid arteries. And then I would palpate the carotid arteries one side at a time for elasticity. Okay. I would then help my patient into a supine position and evaluate jugular venous pressure. Pardon me. The jugular vein should not be distended, bulging, or protruding at 45 degrees or greater. So he would be a little bit lower than this. We're not going to adjust this bench at this time, but I would be, if he wasn't wearing his shirt, I would be watching his jugular vein at a lower angle, and watch for that to be bulging, protruding, or pulsating. And in that position, it would be a good time also to evaluate for any male breast tissue or lymph node tenderness in the axillary glands or in the axillary region. So I would also check that as well. And I would inspect and palpate for any abnormal masses or swellings. So I'll also inspect his upper extremities, looking for symmetry and looking for redness, any gross deformities, checking for range of motion. Are you able to shrug your shoulders okay? Okay. And then I would be palpating for tenderness, any tenderness in your arms.
No.
Okay. Alright, and then I would be checking for the lymph nodes with this, the epitrochlear lymph nodes, which are located just inside and above the elbow. I could also feel for the brachial pulses while I'm feeling here. right. I would be checking for range of motion of the elbows, which I've observed during the course of the exam. There's full flexion, extension, pronation, and supination at the elbows. I would be also looking for radial pulses. Ulnar pulses are not typically assessed for, since they're much deeper than radial pulses and often pretty difficult to assess. So I would check his radial pulses. And checking to make sure that they're equal and strong. And also checking beats per minute. And also respirations. This is also a good time to check the range of motion of the wrists, which is full range of motion, and inspect and palpate the palms of the hands, and the range of motion of the fingers, to check and make sure that there's full flexion, extension. Also with the fingers, that there's the hyperextension and thumb rotation. I would also use a reflex hammer to test the biceps, triceps, and brachioradialis reflexes of the upper extremities. Here, here, and here. I don't have a reflex hammer, and I've never used a reflex hammer, never been taught to use a reflex hammer, so I'm not going to mimic that either. At this point, I'll move on to the posterior and lateral chest exam. So if you wouldn't mind sitting up, I'm going to take a look at your back and the sides of your chest. If the patient was wearing a gown, I would expose his skin and do a skin assessment, as well as inspect the scapula and chest wall. I would be noting any use of accessory muscles for breathing, and evaluate the chest expansion at the T9, T10 area. I would percuss at the posterior intercostal spaces. Of course, directly at the skin, to make sure that I can find these landmarks. And here as well. I would determine the diaphragmatic excursion. By percussing and listening for dullness after a forceful exhalation, and then beginning at the T7, and then until the tone changes, listening for the resonance change, and then do that again from the bottom up. And then measure the distance, or not from the bottom up, I'm sorry, percuss until there's a resonance change and ask the patient to take a deep inhalation and percuss again, and then measure the distance to check and see the difference of the air. The normal change is 3 to 5 centimeters in an adult. I would be listening to with the to the posterior chest, to the breath sounds directly to the skin in a lab.
Alright, I will auscultate breath sounds in a ladder pattern, direct to skin with my stethoscope. Let me take some deep breaths while I'm listening. Thank you. Listen to the anterior breath sounds since I'm still wearing my stethoscope. And heart tones. Alright, and I'll test for 2-point discrimination by placing my thumbs on his back. Can you take a deep inhalation? Alright, and watching my hands spread as he exhales, and gauging the distance between my thumbs after the spread of, after he's exhaled. It should be about 5 to 10 centimeters. Alright, you can relax. Thank you. Alright, and then I will be inspecting his anterior thorax, inspecting the chest, looking for symmetry. The sternum should be midline, noting the quality and pattern of respirations. They should be relaxed, effortless, quiet, without retractions, no wheezing. I'm observing the intercostal spaces. There should not be any retractions or bulging. Palpating the anterior chest at the area of the heart. Also looking for tenderness, sensation, surface masses. I already did the breast inspection too, and palpating quite a bit here. Percussing the anterior chest wall at the intercostal spaces, across and down, starting at the clavicular line. Of course, without a shirt. Find these landmarks. Listening for change in residence to help identify the location of organs. And testing for skin motility or mobility and trigger at the clavicle. It should be moist and without tenting. Inspecting and palpating for the apical impulse at the 4th or 5th intercostal space, mid-clavicular. When the patient is lying down, you should be able to palpate that, you should be able to feel it. And with the chest palpation and the thorax palpation, palpating the apex of the heart, the left sternal border, and at the base of the heart. Which is what I was doing there when I was palpating his chest. I would listen over the aortic area as I did earlier, listening for any fourth S sound. abdominal assessment would cover the patient's body and expose his abdomen. I would inspect for lesions, rashes, scarring, also looking for symmetry, for any obvious bulging. I would be looking for aortic pulsations or for peristaltic waves. I would be listening for vowel sounds beginning in the right-left quadrant. Of course, this works best if the patient is supine. And listening with the bell for aortic pulsations and thrills. And also listening to iliac artery and femoral artery as well. I'll percuss the abdomen for the also percussing the spleen and the kidneys. Let me know if you have any tenderness here.
No.
Alright, and percussing there. And palpating for the spleen on the left, palpating for the liver on the right, doing some light palpation of the abdomen, any tenderness or pain, and doing some deeper palpation, liver, spleen. And with the legs, feet, and toes, of course, I would ask the patient to remove his shoes. We're not going to do that now. But I would be checking skin color, looking for muscle tone and strength, range of motion of his legs, hair distribution on his lower extremities. I'm looking for swelling, shininess of his lower extremities, lesions or sores. I'd be palpating the joints of his hips, testing range of motion, but I've seen him be moving around during this assessment. He does have range of motion in his hips without pain, also in his knees and feet. I'd be palpating his legs and feet, checking for tenderness or pain, also assessing capillary refill in the fingers and toes, looking for a refill less than 2 seconds by depressing the fingernail and watching for the color to come back. Be checking for dull and sharp sensations in the lower extremities. And do you remember those 3 words that I gave you earlier?
Red square pencil.
Excellent, thank you. I would also be looking at his spine, looking for curvature. Since I've already looked at his thorax, that's something that I would have noticed at that point. Checking his gait. I could also do a tandem walk test with him by asking him to walk heel to toe for a few steps to see his balance. I could also ask him to hop on each leg to check his balance. I did ask him to do a finger to nose test for balance and coordination. At this point, no. I would also be assessing the male genitalia by visualizing and inspecting the penis, palpating for urethral discharge, inspecting the scrotum, palpating both testes and the epididymis, transilluminating the scrotal contents for masses, and inspecting for bulges in the inguinal and femoral areas, and palpating for scrotal hernia. I would discuss with the patient techniques for testicular self-examination and inspect the perineal area, also inspecting the sacrococcygeal area, and inspect the bulges and lesions while asking the patient to perform the Valsalva maneuver. I would also perform the rectal exam by asking the patient to remain standing and bend over the exam table, by donning a clean pair of gloves, palpating the anus, the external sphincter, and palpating the rectum. That concludes this head-to-toe physical examination. I extend my gratitude to my patient. Thank you very much for your patience.
Thank you, see ya.
Okay, thank you very much. Thank you for my audience. And thank you for my instructor for your time and patience in grading this.